We know specific relationships between certain bacteria or families or groups of bacteria and the immune system attacking specific tissues in the body. In autoimmunity, we know it's sort of a perfect storm of factors that come together to create the environment where an autoimmune disease can manifest itself. And those three major elements that need to be there is first a genetic susceptibility on the part of the person, but they also need an exposure to some environmental antigen that's going to flare up their immune response. Many times this is a microbe that would be overgrowing in the gut, most commonly bacteria. Certain bacteria have certain proteins on them which the immune system looks at to learn that structure so that they know what to attack. They know what's the bad guy. Sometimes that structure is very similar to a protein on one of your own tissues. And the body can get confused. It's called molecular mimicry, and the presence of that bacteria overgrowing and a genetic susceptibility can actually result in the immune system then inappropriately getting confused and attacking a very specific tissue. We know specific relationships between certain bacteria or families or groups of bacteria and the immune system attacking specific tissues in the body. So there are certain overgrowth patterns associated with different types of autoimmune disease. And then the other final factor is that there are referendums on the test to look at the probability of leaky gut or inflamed mucosal barriers, things like zonulin, things like calprotectin. And if that's in play and there's leaky gut, that's another risk factor for autoimmunity. So we need to take steps to try to change the health and the integrity of the mucosal barrier. Pancreatic elastase 1 has been shown over the years in research, primarily out of Germany, to be the best marker to get a referendum on overall output of pancreatic digestive enzymes. Rather than have to test each of the enzymes, like having to test for proteases, amylase, lipase, elastase, it's been shown in a multitude of studies, it's very repeatable, that as elastase goes, the rest of them go. So if you can just look at elastase, you have a pretty good idea how the pancreas is doing producing all of those different enzymes that we rely on to digest our foods. The added benefit of testing elastase is that most digestive enzyme supplements do not contain elastase. So even if they're taking a digestive enzyme supplement, you can look at the elastase marker and it will not be altered by the fact that they're taking an exogenous enzyme product, because that product will not have elastase in it. The GI map's main inflammatory marker is fecal calprotectin. Calprotectin is a protein that is found, it's produced and found in along the GI mucosa, and then it is shed into the lumen. It can be found in a stool sample in patients that have inflammation, whether that inflammation is due to an infection or due to some other sort of irritant, such as a food intolerance, like a gluten and gliadin intolerance, or in many cases, if it's very, very high, it can be a sign, although it's not a definitive diagnostic marker for colon cancer. Drug-resistant genes are included on the GI map test, specifically in scenarios where a practitioner might want to use a prescriptive agent or a prescriptive antibiotic to treat an infection. So we're looking throughout the microbiota with a particular eye with H. pylori to resident genes within those bacterial populations, which would render them a resistance to specific antibiotic agents. And if the resistance genes for a specific antibiotic agent are there, they are not the antibiotic you would choose to use clinically, because the organism would simply be resistant to it, and you would be actually fostering even more antibiotic resistance, because you're culling the herd to shape it with that specific antibiotic resistance. So it's something you would want to intentionally avoid, not only because the treatment might not be as efficacious, but you might actually be making things worse.